Hello, I'm Dr. Don Selvey, and in this edition of Doc Talks, we're going to provide an introduction to hormones for you. There's a lot of conversation about hormone replacement therapy, so I thought what we would talk about is what are hormones? Why is replacement necessary? And most importantly, is hormone replacement safe and effective? I think that in order for us to fully appreciate the medical treatment that is known as hormone replacement therapy, we need first to understand how hormones are used in the human body. This presentation is slightly technical. I apologize for that, but the good news is there's not going to be a quiz later. Here's the concept for you to consider. The body has about 100 trillion cells. Cells are not inactive. They don't just exist. They all have at least one, usually more than one function. And since cells have a function, it must be necessary for cells to communicate. If cells communicate, how do they communicate? That's going to lead us into an overview of the endocrine. So, what we say here is that to work effectively, there has to be a great communication system between cells, tissues, and organs. In fact, the brain has to tell the body what to do. There are two elements to the brain telling the body what to do. The first one is the nervous system, which most people know intuitively, and the second one is the endocrine system. So, when we consider the two different elements of communicating with 100 trillion cells, the first is the nervous system, which we all know about. It's fast. The impulses go from the brain to various parts of the body in a matter of nanoseconds. Because of that, it is very short acting and it is very, very efficient. It is targeted. It is precise. Those signals may be chemical or they may be electrical. And sometimes, in fact, usually it's a combination of that. The endocrine system, on the other hand, is much slower. This can take minutes or even days to have total effect, but it's going to last longer as well. It's not as precise, more cells are going to be involved, and always the signal is going to be a chemical, and the chemical is what we refer to as a hormone. So in order for us to be a little bit more precise about this, we're going to talk about the endocrine hormones. There are what are known as exocrine hormones as well, but this is endocrine. That is, these are going to be released inside of a blood vessel. It's it's inside the blood vessel. It's circulating in blood. It's going to be bound to a protein because blood is going to be filtered out by the kidneys, and to a certain extent, even the liver does some filtering. What we want to make sure of is that these hormones that are created in the endocrine glands are are going to be circulated and not filtered out necessarily by the kidneys. When you think about it, the fact that these hormones are going to be bound to a protein to circulate in the blood means it's a more complex system. We have to have a system to bind the hormones to the protein. We have to have another system to release the hormone from the protein. And anytime there is that kind of complexity, there is a opportunity for something to go wrong. The endocrine glands are many. Pituitary gland, pineal gland, thymus, thyroid, parathyroid, the adrenal glands, pancreatic islet cells. Most of the pancreas is exocrine, but the islet cells are endocrine. The testes, the ovaries, and then some other organs that have mostly other effects but do have a little bit of endocrine action, skin, liver, heart, and even the kidneys themselves. At this point, I'm going to introduce what I consider a major concept in endocrine physiology, and this is what's called the hypothalamic pituitary axis, which we normally just refer to as the HP axis. As we go through this, you'll come to understand why it's a major concept. So just a reminder, all hormones are important. They all function in providing a long-lasting signal to the cell. Many of these rather significant hormones operate with this check and balance system. And again, that's where the HP axis comes into play. Let me explain the HP axis a little bit. H refers to the hypothalamus. Well, hypothalamus means that it is below the thalamus. The thalamus is the quarterback or master controller of signals entering the brain. Virtually all signals that come into the brain are going to go to the thalamus. Just inferior anatomically to the thalamus is the hypothalamus. So some of those signals that go into the thalamus are handed off and go to the hypothalamus. Sometimes the signals go up to the brain for you to think about, but most of them are going to go to the hypothalamus so that the hypothalamus can release some hormones to stimulate another gland. That's the pituitary gland. The pituitary gland sits in the very center of the cranium. If you care, the bone structure is called the sella tersa. This is to protect it. It's that important. The pituitary gland then is going to release hormones to signal yet other glands. So it's a check and balance. Signal comes into the thalamus, it's handed down to the hypothalamus. The thalamus releases a hormone that goes to the pituitary gland. Pituitary gland is now going to release hormones to signal yet other glands. It's a check and balance system. So in this hypothalamus pituitary axis or HP axis, we have a hormone secreted by the brain, hypothalamus. It sends a second signal or second hormone down to the pituitary gland in the very center of the brain. The second hormone signal is going to go to yet another gland, and that's going to create a third hormone. And there are a whole lot of these other glands that are available, but that's the HP axis. And what I really want you to get from this is when it's that complex, there are lots of opportunities for something to go wrong. And boy, can it go wrong. When talking about those hypothalamic hormones that are going down to the pituitary gland, there are 8 primary hypothalamic hormones. 6 of them go to one part of the pituitary gland, 2 go to another part of the pituitary gland. Most of these 8 hormones are going to be what are known as releasing hormones, which means they're going to stimulate activity in the pituitary gland. There are a couple that are inhibitory hormones, and they stop things from happening in the pituitary gland. So, talking about the hypothalamic hormones, we have thyrotropin releasing hormone, TRH, corticotropin releasing hormone, gonadotropin releasing hormone. These are all going to stimulate another production of a hormone. Then there is prolactin inhibiting hormone. That's going to inhibit the production of prolactin. Growth hormone releasing hormone and growth hormone inhibiting hormone. The growth hormone inhibiting hormone, which is going to stop growth hormone, is also called somatostatin because it was identified somewhere else first. There are 2 others that require a little bit of a more complicated explanation. One of them is oxytocin, the other is arginine vasopressin. I promise you there is not going to be a quiz, I'm just trying to give you an overview of this. So let's look just at the hormones from the hypothalamus that go to the front part or the anterior part of the pituitary gland. We have follicle stimulating hormone or FSH, luteinizing hormone, LH. These both have a role in ovulation and testosterone production. Thyroid stimulating hormone to stimulate the thyroid gland, adrenocorticotropic hormone to stimulate the adrenals, prolactin produces milk, and growth hormone, which produces growth. All of these are anterior pituitary hormones. Follicle stimulating hormone is going to be responsible for ovarian follicle development in women. The follicle contains an egg that ruptures once a month. In males, follicle stimulating hormone stimulates the production of sperm. Luteinizing hormone in women causes ovulation. In males, it produces testosterone. So follicle stimulating hormone identifies a particular follicle that's going to be released, and the luteinizing hormone releases that follicle in a woman's cycle. In males, the FSH is going to produce sperm. The luteinizing hormone is going to produce testosterone. Thyroid stimulating hormone, generally called TSH, is going to stimulate the growth of the thyroid gland and production of thyroid hormone. The thyroid gland, it is important to know, is the master controller of the body's metabolic processes. If your thyroid is quote unquote low, you have hypothyroidism. In this case, you're likely to be sluggish, fatigued, cold, dull of thought. One form or one cause of low thyroidism or hypothyroidism is Hashimoto's thyroiditis. It's an autoimmune disorder. For someone who has high thyroid or hyperthyroidism, patients could be exactly the opposite: hot, hyperactive, dry skin, brittle hair. And one of those forms is Graves' disease. It is also an autoimmune disorder. ACTH is adrenal corticotropic hormone. It stimulates the adrenal cortex to secrete a type of a hormone, a class that are known as glucocorticoids. One of those is cortisol, which is the stress hormone. This is going to regulate metabolism, especially in response to stress. Prolactin is secreted by certain cells in the pituitary gland. Prolactin is produced by certain other tissues as well: the breast, the muscle part of the uterus, and the prostate gland. This is the hormone that causes the mammary glands in women to produce milk. Well, if it causes the mammary glands in women to produce milk, could it, if there's an abnormality, cause males to also produce milk? And the answer is yes. And that condition is called gynecomastia. And trust me, that's not going to be a good thing for most guys. So the prolactin is going to induce the testes to be sensitive to LH to break testosterone. Prolactin stimulation is maybe a bit more complex than what I have said so far. Two big aspects of prolactin stimulation. One is that when a woman is pregnant, the breast tissue needs to develop. Women who have become pregnant all know that their breasts become much larger. And then, after the baby is born and the baby is nursing, the breast begins to shrink. That's what causes breasts to become saggy after a woman has had her babies, which leads to breast augmentation and enhancement. It's the reason for all of that. The other aspect of this is going to be breast development. So when we talk about breast development, we have estrogen from the ovaries. It's going to stimulate growth of the mammary glands. When the woman is pregnant, there is another form of estrogen. This one is from the placenta. It's going to increase size, it's going to add fat, and it produces that ductal system to allow milk to be delivered. At the end of pregnancy, progesterone causes still more growth of the breast because estrogen and progesterone are going to work together to now inhibit secretion of milk. Prolactin causes the secretion of milk, but estrogen and progesterone are going to inhibit it. Oxytocin is the hormone that causes milk to be released, and that one is stimulated by the baby suckling at the breast. Prolactin is going to be secreted by the front or anterior aspect of the pituitary gland from about the 5th week of pregnancy, and it's going to be up to about 20 times the non-pregnant levels of prolactin. After the birth of the baby, the loss of estrogen and progesterone allows prolactin to control milk production. After birth, levels of prolactin will drop down to non-pregnant levels, but soon as the baby begins to suckle, prolactin levels are going to increase up to 20 times normal rate for about an hour. This cycle normally lasts for 6 to 9 months. However, if the baby continues to suckle, it actually can be induced to last for several years. So while a woman is nursing, the breast is going to produce lots and lots and lots of milk. Ask any woman who's been unable to feed her baby for a few hours, it becomes uncomfortable. Prolactin is inhibited by a hormone called prolactin inhibiting hormone. This is the same hormone as known elsewhere in the brain as dopamine. It decreases prolactin production by about 10x. You can see that there's a fine balance here between these hormones. Let's move on to growth hormone. This one is going to cause cellular differentiation and growth. This is a rather unique hormone in that it does not cause stimulation of a gland. It is actually going to go directly to the cell. The liver produces a growth factor called insulin-like growth factor, or IGF-1, IGF-2. These produce protein synthesis, carbohydrate and lipid metabolism, and growth of bone, cartilage, and muscle. Growth hormone is obviously going to be important in someone growing up, getting larger from the baby to being an adult. Growth hormone is inhibited by growth hormone inhibiting hormone, which is generally referred to as somatostatin. You can see why some young athletes, even some older athletes, like to have growth hormone. It's not a good hormone to have, and that's the reason that growth hormone is essentially banned in this country. So we can move on to those couple of hormones from the posterior pituitary, the other two that are important, oxytocin and vasopressin. Oxytocin has a role in a couple of different things. One is childbirth. It's going to stimulate contractions during labor. One of the reasons for this is to control any hemorrhage that may be occurring because of the uterus being pulled apart. Oxytocin is going to stimulate milk letdown and flow. It does not have a role in producing milk. It has the role in causing the milk to be able to flow. There's probably a role in bonding between mother and child. We think oxytocin also has a role in producing an orgasm during intercourse, both male and female. So it increases sexual satisfaction. Arginine vasopressin is kind of interesting too. Again, as a posterior pituitary hormone, it is going to increase water retention by the kidneys. When there is an increase in water retention, it means less urine is going to be produced, and that will lower blood pressure. In blood vessels, it causes vasoconstriction. That is, the blood vessels get smaller. Well, that actually is going to increase blood pressure. It kind of balances out. In the brain, arginine vasopressin is a neurotransmitter. It's actually used by some of the neurons in the brain to communicate with the next neuron in the chain. All right, now we've talked a little bit about hormones, and you might be able to understand pretty readily that when hormones are not produced as they should be, something is going to feel off. Sometimes hormones are produced in excess, sometimes the hormone production is deficient, but many times hormones are produced and just cannot be used. Maybe the structure is wrong on. Regardless, your body works very, very hard to get that imbalance under control, but sometimes you need a little bit of help. Therein lies the role of hormone replacement therapy. HRT, hormone replacement therapy, can either enhance deficient hormones or block hormones that are excessive. Obviously, to do HRT, we have to start with an evaluation of hormone levels. Sometimes that's a blood draw, sometimes it's found in urine, and sometimes it's even better found in saliva. Depending on the hormones being evaluated, multiple collections during the day may be required. That is especially true for cortisol, which is your stress hormone, and so you want to collect that about 4 times during the day. All right, that's what we're going to leave you with on this edition of Doc Talks. I know it's been a little bit long, but this is our introduction to hormones. Thank you very much. I'm Dr. Don Selby.